joining us. And I think we are ready to go live. So also Isa, we are starting to let people in. All right?
Okay, I'll wait until they're in.
Wonderful. Thank you very much. Have a great session. And thank you again for joining.
Okay. Good afternoon, everyone. I would like to welcome you to this session number 4 of the Include conference. My name is Isa Boud. I'm the chair of the Include Knowledge platform, and I will chair this session as well. So a very special welcome to our roundtable participants this afternoon, who I will introduce shortly. But I would like to start by informing everybody about our house rules. So we kindly ask you to mute yourselves, to limit the background noise, and not to interrupt the flow of the speakers. Don't unmute yourself unless the moderator gives you the floor. Now, this session will be held in English, but there's an English-French translation available. And to access that, you can click Interpretation in the meeting controls, the bar below, and select a language channel. And if it doesn't work, I think in the chat, there will be an indication of I think it's Agnieszka who can help you then to gain access anyway. Now, during the meeting, we'll be taking screenshots. So if you don't wish to be included, please turn your camera off. Finally, to facilitate interaction with the audience, we're going to use Slido, which you can see here on the screen. So you can see the chat to log into Slido with this code, and then you'll be able to include your opinions when they are requested during the course of the meeting. So that's for the house rules. I'd like to give a very brief introduction to this session on modeling social protection responses on the continent, in which we're talking about the ways that donors meet policymakers. There's been a rise in the social protection programs in Africa over the past decade. But still, despite this significant increase in the number of countries with policy frameworks and cash transfer programs, the coverage before COVID remained below 10% of the population in many countries. The global momentum for social protection measures in response to COVID-19 included African countries, although the fiscal capacity to respond was much lower than in other areas. Therefore, it's of utmost importance to ensure that the population continues to have access to social services and social protection. Now, the social protection responses must consider differentiated impacts of COVID-19 on vulnerable groups, gender differences, and among those surviving in the income from the informal sector, informal economy, as well as those now shouldering more unpaid care work. So in today's session, we're going to talk with African policymakers, bilateral donors, and lead thinkers, discussing best practices in social protection responses on the continent with a view to embed social protection in a structural manner in the policies of African governments, and to discuss the way forward for social protection post-COVID-19. We have a very interesting panel of experts to talk, who are going to discuss these issues. I'll go through them briefly before handing over to the moderator. Mr. Sabelo Mbokazi, who's head of the Labor, Employment and Migration Department of Social Affairs of the African Union, is with us. Ms. Rita Owuzu Amankwa, who's Director of Social Protection at the Ministry of Gender, Children and Social Protection of the Government of Ghana. Mr. Gift Dafuleya, who's a lecturer at the University of Venda and a research associate at the Center for Social Development in Africa at the University of Johannesburg. Mr. Nicolas Awortwi, Director of the Institute of Local Government Studies in Accra, Ghana, and a longstanding member of the Include Knowledge platform. Ms. Ulrika Lang, she's Senior Policy Advisor, Social Protection and Institutional Development Africa at the Swedish International Development Cooperation Agency. Mr. Ralf Radermacher, who's head of the sector Initiative Social Protection, as well as the global program Social Protection Innovation and Learning at GIZ. Mr. Timo Voipio, who's currently head of cooperation at the Embassy of Finland in Dar es Salaam, Tanzania. And finally, Ms. Jolijn van Haren, who's senior policymaker at the Netherlands Ministry of Foreign Affairs and part of the internal working group on social protection. I'll hand over briefly to Jolijn van Haren, who will emphasize the importance of this section for the Ministry of Foreign Affairs. And then I will hand over the discussion to the moderator of this session. Please, Jolijn van Haren, go ahead.
Thank you very much, Isa, and welcome everybody. And I feel very honored to be here. So my name is Jolijn van Haren from the Netherlands Ministry of Foreign Affairs. And as Isa mentioned, and I think all of us in the room are very much aware of the importance of social protection as an effective instrument to reduce poverty and inequalities. And we also know that during the current crisis, all the needs of the people are absolutely not being met by social protection. We do not reach the people we do need to reach urgently right now. The coverage remains very low. So the Netherlands has been involved in social protection for more or less a decade. In Ethiopia, we support the PSNP. Mozambique, we support the cash transfer program. And in Sudan, we recently joined the family support program. And in our humanitarian aid, social protection and cash transfers are integrated. So I think from these programs, they are very different. They are in different phases. They have different purposes. They have different targeting. They have different funding mechanisms. So I think what we are still trying to learn better is how we as a bilateral donor can do our utmost best in support national owned social protection systems. And in that way, it is very inspiring to be here today to learn more from the African perspective on especially the do's and the don'ts for donors. I think we should be really honest about that. And also to learn from other bilateral donors and countries, how they really integrated social protection in their broader policy and programs. So I'm actually a student here today and very much looking forward to it. Thank you very much.
Thank you very much indeed for indicating the importance of social protection and the way that the ministry looks at it. I would like to introduce now Ms. Rachel Sabatis-Wheeler, who's a development economist with over 25 years of experience working in the area of rural development, institutional analysis, and social protection. She's a professorial fellow at the Institute of Development Studies and a co-director of the Center for Social Protection. She's going to moderate the coming session, the roundtables, with a series of questions that we have for this session. Rachel, let me hand over to you.
Okay, thank you, Isa. Thank you, everybody. I've met some of you before, so it's good to see you again. So I'm the moderator for the session. I'm Rachel, and I have been asked if I can help move the discussion, and I'm going to essentially be posing some questions. You will have seen them already, but I might adapt them as we go, depending on how things move along. And the questions are really going to be answered by the people that you've been introduced to already, the panelists from various international organizations and different governments and universities. And I think the rules apply. If you really want to answer something, or you want to say something quite pertinent to a point, if you can just raise your hand electronically, particularly those on the panel, or even visually if I can see you. For those who'd like to make comments, please do in the chat box, and I'll try and keep an eye on them, keep things going. Great. Okay, so the first set of questions is really around the assessment of the status quo of social protection. So about 20 years ago, when I first joined the Institute of Development Studies, I started working with Stephen Devereux on issues around safety nets. And social protection was quite a new term then. It hadn't really been talked about. People used to talk about safety nets. And we were working in Uganda and Malawi, and people started saying, oh, social protection, social protection. And at that time, 10, 20, 15 years ago, we thought, oh, maybe this is just a passing fad. Maybe it's just some terminology that's going to come and go. Maybe it's a donor fad, because it was very much donor speak, development partner speak. But actually, over the last 5 to 10 years, we've seen an explosion of social protection programming, policies, strategies, systems, and we've seen it now in the SDGs, but we also see a lot of policies, government, national, African policies, social protection policies and strategies. And COVID has really illuminated the response of social protection to a lot of new and, well, not new, but unusual vulnerabilities that haven't always been thought about. So we're going to think about these things now. So to kick off then, this status quo, I thought we could ask the question, why do the panelists think that social protection has become such a huge development agenda in the last 5 years in particular, but last 10 years? Why has it become such a huge development agenda for donors and international organizations? And for those who are sitting in ministries or in African universities, has it actually become that big an agenda for you? And if so, why is that? So I wondered if anyone would like to kick off some ideas. Why do we think it's got so much attention, whereas it never did if you rewind 20, 30 years? Who would like to kick off? Rita, I saw you unmute yourself.
Yeah, thank you very much for this opportunity. I think that the rise to prominence of social protection in the policies of development donors and even the governments of developing countries can be attributed to a lot of factors, but most significantly the issue about human rights backed by the Universal Declaration of Human Rights. In the Article 22 of that declaration, everyone has the right to social security and social protection. So that is the foundation of social protection being the number one agenda of many people. And again, there is overwhelming evidence that social protection schemes can deliver rare results in terms of poverty reduction. It is increasingly being understood as an investment in people. Most people think that it's a wasteful cost, but in actual fact, evidently, people are realizing how important social protection can contribute to sustainable and resilient economic growth by raising labor productivity as well as ensuring enhancing social cohesion. Social protection is, the holistic approach of social protection and dealing with poverty and social inequality has really made social protection a great tool that the governments and donor agencies are using. In Ghana, maybe you'll get the chance of talking about Ghana's experience, but for me, this is the reason why social protection has become a great topic and tool for developing the country and also addressing vulnerabilities and inequalities.
Great, thank you, Rita, for kicking that off. So you've mentioned a lot of things that social protection can do in terms of raising labour productivity, dealing with poverty, social inequality, poverty. These are all things that social protection aspires to do. So Nicholas, you wanted to say something?
Yes, thanks very much, Rachel. Yeah, I think other factors may have contributed towards this trend. First is the failure of the so-called trickle down, and the fact that even when there's a rising tide, it doesn't lift all boats. I mean, for almost 3 decades now, we are seeing growth in many African countries. And at the same time, we are seeing increasing inequality and poverty. And so it tells us that even if we have increasing productivity and everything is happening very well, not everyone will benefit. And that there's a need to provide support to those who are not benefiting from the economic growth. And so the idea of inclusive growth came in and social protection rose. I think second also, there is an ideological convergence here. Social protection had never been, new to many African countries. We have our Ubuntu, we have all sort of informal mechanisms. And somewhere in the 80s and 90s, when mismanagement led to reduction in some of these social protection mechanisms, free education, free healthcare, the structural adjustment came in and removed many of these policies out and many of these practices. But now, the World Bank and the IMF were against this freebies and then social support mechanism of this government, have now become cheerleaders. They have realized that it works. Development partners also wanting to see their euro money reaching the poor and not being embezzled through many government intervention programs. I also seen the need that we can reach the poor with social assistance programs. So all of a sudden, there's a convergence. And then African politicians have also realized that, it's not a bad idea to give money to the poor because it let them win elections. And so politics now meets ideology of donors and the development partners. So I think this is where that convergence is leading to increasing practice of social protection.
Thank you. Thanks for that. That raises some really interesting questions around ideology of social protection. Did somebody else from the panel want to respond? Ulrika looks like she might want to.
Yes, thank you. I think you have raised very important points, and I think there was a recognition that we hadn't really managed to reach people living in extreme poverty with the policies of the previous decades. And so we have this SDG agenda with a focus on leaving no one behind and prioritizing those furthest behind first. And then social protection has really come out as an effective tool to address multidimensional poverty. And there was a lot of skepticism, and there still is some skepticism towards cash transfers and towards giving money away. There's a lot of conceptions about this that are based on myths, more or less. And this has led this has also encouraged a lot of research. So we have very strong evidence base from impact evaluations with randomized control trials that have shown the positive effects and the impact of providing social protection to people living in poverty. And I think that is also one important factor in why we have seen a more rapid expansion and more investments in social protection in the last few years.
Thank you for that. I agree. There's been a lot of evidence created, a lot of impact evaluations. A lot of the evaluations that I've looked at and I've helped with, there's very strong impacts on things like food security and consumption. There's less evidence of long-term resilience. That's kind of something we need to get better at. But I thought I'd say that. So there's really strong evidence around certain indicators. Other ones we probably need longer stretches of data to really figure out. But someone else on the panel, any views on what's been said so far? GIF.
Thank you, Rachel. I think for me, like if I look at the developments prior to year 2000, I can pick that here and there was social protection in terms of the legal frameworks of African countries. If you look at the constitutions prior to 2000, they would state things like providing social security, social protection. So in terms of legal frameworks, some countries had, without necessarily even making it a right, but it was there on paper. We also have countries, particularly in Southern Africa, that also had social protection sort of institutionalized. Like if you look at South Africa having pension from 1928, if you look at the likes of Namibia, they also had some cash transfers then. But there was this wave that then came, starting from 2010. Like if you then move from legal frameworks and maybe start to look at policy documents that were developed, particularly by development partners or donors. If you look at 2010, they started coming up, and within 5 or 7 years, we then had about half of the African countries having these policy documents on social protection. So if you count that, you start to see this wave really moving in Africa in terms of policy documents that get to be adopted in order to try and perhaps run along with social protection programs. And along with this were the actual programs that were run. Before 2000, you'll find that, like I've said, most of them were in Southern Africa. But after that, if you look at West Africa, which had the highest number of policy documents relating to social protection, also started to have programs. And it introduced over 60 programs, like within a period of 5 to 7 years, only from West Africa. So you can start to pick the wave. So if you look at the indicators in terms of programs, in terms of policies, you start to see a contagion effect happening, partly pushed by development partners, as well as partly pushed by the governments themselves, who also take on these programs and try to also finance them. So I think that also for me defines the wave that has led to the development of social protection in the continent.
Thank you, Gif. That's really interesting. I'm going to come to Sabelo, but I just want to, there's some comments coming in. I don't know if, one of them, why has there been such a focus on cash transfers compared to other forms of social protection over the last 5 to 10 years, such as, social insurance and other forms. I don't know if you're able to respond to that, Sabelo, as you respond, or if you wanted to come in on something else, but go ahead. You have to unmute yourself.
I'll come on. Thank you very much, Rachel. Indeed, I'll come on maybe something else. Maybe I'll touch upon why there was an increase on cash transfers. Indeed, the colleagues have made mention of several drivers of the increase and expansion of this area on social protection. We at AU focus on policy formulation, policy analysis, policy research, and policy advisory. And indeed, if you look at the trends in Africa, the drive for reducing poverty is still there. The drive to narrow the gap in terms of inequalities is still there. The drive also to bring the masses of people for instance, in rural areas who are marginalized by poverty and various things is there. So if you look at in the 2000s coming up into the recent times, there was this concerted effort internationally. That's what saw the development of the MDGs in the 2000s. That saw the development of the SDGs currently, and the social protection in terms of the research, in research and yes, advice that is there, and knowledge. It is clear that social protection has been identified as vital to support reduction of poverty. Is also seen as it has been mentioned, a vital tool to deal with inequalities. But then I just want us to draw our attention to what was happening in the early 2000s within the health sector. We know that HIV and AIDS in Africa was high on the agenda. And maybe to respond to the question on the rise of the cash transfers, when HIV and AIDS was high on the agenda, what was the impact? The impact is that then the families or the family structures would lose the breadwinners. That's why in the early 2000s, we were talking about the child-headed families. Then the response to that was that how do we deal with this phenomenon, which is emerging of having child-headed families? And that is where the solutions like cash transfers then also came in to be part of the solution. But I do agree with Nicholas in terms of the political ideology and the convergence with this domain of social protection. Because if you listen to all the political parties who are campaigning for elections, one of the key issue that you would not miss in every manifesto is every political party say is going to deal with unemployment, the high unemployment, which is then the solution to that would then be social protection to deal with the impact of unemployment. Maybe hold it there for now. Rachel, thank you.
Thank you for that. I think, another reason why social assistance has become such a big instrument, because social protection at large is much more than just cash transfers. I'm sure most of you know that. It's non-contributory provisions such as social pensions, and food assistance, but it's also contributory such as my maternity benefit and my pension, that's social protection. And it's also a bunch of other things. So we tend to focus, particularly in a lot of African countries, on social assistance, that specific part of the social protection agenda. One reason is because of the large informal sectors. People aren't making contributory forms of social protection. So there's been a large, some countries, not the whole of African continent, some countries, huge populations, highly vulnerable, not able to make regular contributions. So social assistance has been very much part of the protective coping strategies, helping people to move into either formal sector or more resilient livelihoods. And later on, they might be able to move into jobs that would allow them to move into contributory forms of social protection. So that's one reason social assistance and cash, there's been that move towards cash away from food as well. Although we know in a lot of countries, food is still vitally important. I wonder if somebody else would like to come in on any of that before we talk a bit more about inclusion and targeting. Ralph?
Yeah,
Ralph and a Rolf. So we'll go with Ralph first and then we'll have Rolf.
Thanks. Maybe to add a few points. You're absolutely correct, Rachel, with the reasoning for the big shift to cash transfers, and particular reason on, obviously, if we focus on the poorest contributory scheme like a social insurance, is more difficult to implement, but also administrative costs are far lower in cash transfer schemes than they are in social insurance schemes. But there are some examples on the African continent, particularly if you look into also the health domain. For the informal sector, for example, in Tanzania's CHF Ilio Bereshwa, the health insurance, the government's health insurance for the informal sector is implemented as a contributory scheme and rolled out across the country in the reformed version. And as Gift mentioned, there are obviously examples of longer standing pension schemes and so on, which however focus more on the formal sector, if I'm not mistaken. Gift, correct me if I'm wrong, but that's also the history where it came from. I think we did see for quite some time in Africa, predominantly schemes focusing on the formal sector, and that really changed with that focus on an informal sector, and with that, the emergence of the cash transfers as one of the prime tools for reaching the informal sector, which I think is good and is a good starting point to build around. Has own complexities in terms of targeting, own complexities in terms of delivering, and sometimes you might have also political considerations on the political domain, on the handout perception versus public works programs where the government might feel they are getting something in return and so on. So, but it is a good starting point to really build a coherent system around. And I think both Rita and then also Nicholas mentioned quite an amplitude of reasons for that expansion in the very beginning of your question.
Thank you, Ralph. Sorry, Rolf, I'm going to go to Timo first because he's on the panel. I was asked explicitly to take comments from panel. If you've got something to write, though, please, can you just put it in the chat? Would that be okay? Timo.
Thanks, Rachel. This is a very, very wonderful event, meeting lots of old good friends and partners. And actually, as Rachel told, the times when you started with Stephen Devereaux, you were kind of ghost writers to a team of OECD technocrats who were trying to find ways to operationalize the common commitment to poverty reduction. And we all were committed to poverty reduction, but actually we meant all very different things. We came to some kind of a conclusion that social something would be what we would need to do. But if you looked at the French and the British and the Nordics and the Southern Europeans and US, we were using different concepts. Some were talking about social security, others about social protection, social insurance, social care, social development. And Rachel had hard time trying to kind of bring these all into one common kind of a map that we could all use. So it was very, very clear that we did not agree on social protection related things. It's quite fantastic to realize that now I agree with everything that anybody before me here has said. We have achieved kind of a common understanding about what we mean by social protection, and we heard some very, very good good arguments there. I think the one argument is that we had kind of poverty projects, which included a kind of an economistic assumption of an invisible hand that would turn the poverty growth and so on into better welfare for people. And we started to doubt whether that invisible hand exists. Then it's also mentioned already here that the social contract argument was very, very strong. We need manageable societies where people need to receive at least something from the government to be able to agree to be managed and governed by the and it's a tool for winning elections. It's one of the best tools for winning elections. There have been many much worse tools that governments have used to stay in power. Then on why just cash transfers, I think it's clearly related to this poverty focus. We needed to find ways to reach to the poorest people, and actually even today, now that I'm here in Tanzania, I'm realizing that most of development cooperation is about pilot projects. Most of it is about demonstrating some good practice in 1 or 2 districts, and then again assuming that some invisible hand somewhere is going to then deliver the benefits also to all the other people in all over the country. But social protection, together with primary education and primary health, are just about the only programs that really reach the entire nations. And then why do we stick to this non-contributory cash transfers? We could do, and we have tried to do more on tailoring contributory social protection also for the informal sector workers, and that is an agenda that we have to work much more. Not everyone is going to become formal before they need social protection, so we need to help people to save money for the rainy day through contributory social protection for informal sector. Thanks.
Thank you, Timo. Very nice to see you after some years. I do remember all those meetings we had worrying about terminology. So I'm just going to move us slightly, because this panel, this roundtable is also, it's around inclusion. How do we use social protection as a way to be inclusive? We've talked about inequality, the failure of structural adjustment, the fact that there has been growing inequality. And one of the roles of social protection, so as opposed to safety nets of the past, where it was very much handouts, keeping people alive, surviving but not yet thriving, one of the roles of social protection and the innovations is you move people just from coping and surviving to actually thriving, so they can build livelihoods, and hopefully livelihoods that are empowered and they're included. So people who have problems accessing even social protection, how do you make sure people can access those, the poorest of the poor, the furthest behind? How do you actually get them to be part of your social protection program? So I'm wondering if there's actually some very specific examples. We've been talking quite sort of high level theoretically. Are there specific examples, successful examples, where social protection program has been really, you'd say that's been an inclusive social protection program, not just giving out transfers for the sake of it? Has anyone got any good examples? Yes, Ralph.
Well, it depends a bit now on the definition of inclusive, Rachel. I think there are many aspects of inclusive. Inclusive on the one hand, as you described it, in terms of being really promotive to people and more than a cash handout. I think we have quite a number of examples, for instance, in the Sahel, where there are strong programs on economic inclusion, so the inclusiveness on that side, where programs, converge beyond the cash transfer, some programs of financial inclusion activities, particularly savings, but also economic empowerment programs in terms of, for instance, seed capital for certain assets, and some business training, and really in order to get people, on their own livelihood. The bank very early on termed that actually quite nicely in a 2002 report, from safety net to springboard, and you wonder that we're talking about it 20 years later, so it took long to get it actually from paper into implementation. I think that's one element of inclusiveness of programs and being more than hanging in. But I think inclusive social protection is far beyond. Is really making sure that we have all walks of life represented, all groups and subgroups equally benefiting, accessibility for everybody in the system who is in need. We have fortunately a stronger debate and focus now on making sure that the targeting and assessment approaches are also inclusive, for instance, of people with disability, of gender related aspects. And I think we haven't been very good, honestly speaking, on the inclusiveness of people with disability. It's difficult to capture in the data which was captured for, I'd say, poverty-focused programs, because asking are you disabled or not is difficult. You can try to use a parting question and some questionnaires, from the Washington Group consensus or something of that nature, but there hasn't been very many successful trials. I think it's coming up and more attention is being paid. I want to just pinpoint, as you've asked for a specific one, to an interesting example we've been witnessing in Malawi in the context of a public works pilot, which I thought was interesting because many people with disabilities said, I feel excluded by essentially receiving a cash handout and then being, asked to be passive, just a passive recipient. I rather want to be, part of those who go out and do something for the money they receive. And they said, you just need to define the right, labor I can contribute. I might not be digging, but I could be taking care of kids or something of that nature. So why don't you create work packages which are using my ability and don't exclude me by looking at a ability I might not have? And I thought that was actually a good pilot. So it was instrumentalizing and operationalizing some of the declaration of being inclusive public works, and indeed trying to turn that into a new approach of being inclusive there.
Great, thank you. It reminds me of, I worked with UNICEF Rwanda for 3 years, and we were looking very much at public works provision for women who had small children, and they were piloting a program to pay the women to look after other women's children while they were at work, so that was actually a valid use of work.
Like in Ethiopia, you still have that in PSMP.
Oh, in PSMP.
It's brilliant, yeah.
So Ulrika, you have your hand up.
Yes, I think it's a good question. At the same time, it's a difficult question because expanding social protection systems it's a complex task. It's a huge task. If our objective is universal social protection throughout the life cycle, that is a huge task to realize, and we can only realize it step by step, progressively. And so we don't have the perfect success story yet because we're not there. And all countries and all development agencies that work to support countries will see the trade-offs. There needs to be choices made that aren't perfect, but that's just the way we have to gradually work. But I still think there are very encouraging examples. I mean, the impact evaluations has massive statistics, and we have just actually been working to compile the evidence from research looking at what works in terms of social protection, reducing poverty, and there's very strong evidence. But to mention just a few specific cases, I think Ethiopia is a very good example. It's not a perfect system, but it has really achieved an impact. It has, evaluations show that the Gini coefficient of Ethiopia has decreased by 2 percentage points, largely due to the PSMP. So that's a national scale impact of decreased inequality. And there's also a very clear decrease in the need for humanitarian assistance in Ethiopia that faces reoccurring droughts and reoccurring crises. But through the adaptiveness of the PSMP, it has managed to scale up and manages to take care of needs often before they become a full-scale humanitarian crisis. So I think that is a very successful example, although there still needs to be a lot more people included in and covered by social protection in Ethiopia. I also think there are many examples of how, both in statistics and in in-depth interviews, how social protection and cash transfers contribute to inclusion of those reached. But still, there's a lot more work that needs to be done, and especially in terms of disability.
Yeah, thank you, Ulrika. Before I come to you, Rita, so yes, I'm really familiar with the PSMP. I've been helping do the evaluation, and it's really been an amazing success. However, the last 8 months, what have we seen happening in Tigray? The system in that area has collapsed. And so while if you've got a stable setting and we've got all the things in place, fantastic. But if you take a different kind of humanitarian crisis and conflict, it looks like we've got a lot to learn on building resilient systems as opposed to just building resilient households. So that's kind of an interesting angle to think about. Rita.
Thank you very much. On the question of cash transfer, why cash transfers are being used most frequently as form of social protection. I think that one of the speakers said that it's a good starting point, and I endorse that. It's a very good starting point to reach the vulnerable in our society, where you have people who are in extreme poverty, who cannot afford even a meal a day. Then probably you find a way of quickly reaching them with means of supporting them, at least getting one hot meal a day, and improving nutrition and smoothing consumption. So these are very important objectives that any government, would like to really achieve quickly to enable him or it reach a lot of people. So cash transfers, people think that are just giving cash, but in our system in Ghana, we have really had situations where people with these small monies that we give them have been able to build their small businesses. There is an impact assessment done by the University of Ghana on livelihood empowerment against poverty, one of our flagship programs, and that indicated that any one cedi given out, we are gaining 2 cedis back. And so the cash transfers are not just giving cash to people. We are giving cash to improve their nutrition, the nutritional level, to smoothing their consumption, and even help them to set up small businesses that are giving them additional income. And so it is a very good starting point. And somebody also raised, I think you raised the question of inclusion. And I think that is a very important, criteria and or goal to reach, to make sure that those who are in need of the cash transfer, or the funds are getting. In Ghana, people talk about political influences, that people who are supposed to get the money are not getting. So systems have been put in place to ensure that the monies get to the right people. For instance, we used, as you may know, the prominence test to make sure that we select the actual people. Initially, we were, apart from the prominence test criteria that we use, we also, we combine it with poverty and some specific categories of vulnerability to make sure that those who really need the interventions are getting. So for instance, we targeted orphaned and vulnerable children. We targeted aged, especially elderly over 65 years without support. We also targeted people with severe disability, and also the very poor pregnant women and mothers with infants under 1 year. This is to ensure that we are first targeting people who really need the support. And then we can consider, eventually, about 2 years ago, we wanted to remove these categories and target extremely poor people. The Ghana Statistical Service indicated that we have about 2.4 extremely poor people in the country. And so we wanted to target them to make sure that we reach them. But, the limited fiscal challenges couldn't allow us to do. But at least we have been able to target at least 1.5 of them, 1.5 million of them, targeting about 334,000 households. The LEAP, for instance, started with 1,625 households in 2008, and now we are currently targeting or reaching out to 334,000 households, translating to 1.5 million people. In this category of people, all the beneficiaries, we have 60% of them being women or women-headed households. So the inclusive, we are conscious about, making sure that the right people and those who really need support are getting the support. And of course, we have moved away, we have moved beyond cash transfers and have also added, public works, and even trying to reassess the program to make sure that we retarget and we use the Ghana Household Registry data that is now, because we use a census approach, we were able to target and reach almost everybody that's in the catchment area. So I will just pause here and wait for another opportunity.
Thank you, Rita. We've got Nicholas and then Timo and then Gift. I wonder when you're talking, if you could also, if there's any specific examples you have also of specific programs that have been good in terms of inclusion. Nicholas.
Thanks very much. Yes, I think, to promote inclusion, there are a number of instruments that a country, uses. And Rita, from the Ghana's perspective, is talking about, still cash transfer and support to the poor, especially the elderly. And I think that is a population of 4%, less than 4% in many African countries. So it is easier to bring this 4% population into the inclusion by providing them social support. Many of these people, they are 65. And so without social support, social security, many of them die before they are 70. And it's the reason why in almost many African countries are implementing the social assistance to the old age. So that's one of the inclusion. But the key ones are the youth unemployment. They form about 30%, the youth unemployment. And that is where the target hasn't been. And one of the key instruments is free senior higher education, which in Ghana, I think the government has invested a huge amount of money. About 1.2 million school-going age, the youth, are now involved in free senior higher education. You can only remove poverty or kick poverty out and never return if people increase their level of education. And so free education or free senior high school education is one of the most important instruments to bring majority of the youth into this inclusion. And in Ghana, I think it's only one or a few countries in Africa to be doing this. And I think that this is where the direction should go, making sure that the productive sectors. Then there's also the youth employment schemes. I think Ghana launched a number of youth employment schemes. This is public works programs that are bringing so many people into productive sectors. They may enjoy small amount of money, but it is better, it increases productivity, and that removes the skepticism that people have, especially in the ministries of finance and many, African growing middle class about cash transfer. So I think this is where the direction should go. But this is where there isn't much because the population is huge and the government doesn't know what to do with them.
Great. Thank you, Nicholas. Timo.
Thank you. The heading or the question was about inclusion, and inclusion is a central term in the human rights-based approach that the government of Netherlands is committed to, and government of Finland and the EU and all of us. Social protection is a human right, but what I would like to emphasize here is it's not only the human right to the decent standard of living, but it's a human right to meaningful participation. And we know that for very poorest people, if they're struggling day in, day out for their survival, they cannot possibly participate meaningfully in economic or social political life. And the big question in terms of that inclusion is the capacity of social protection to turn the economies into inclusive economies, and there the care economy is a key concept where for the good majority of people, women, whatever enterprise development projects or whatever we organize or political participation programs, they still only have 24 hours per day, and they have the unpaid care burden at home. And unless we find ways to formalize care work in some way, it's not going to be possible for women to participate full time in the economy or as entrepreneurs or politically. And now, besides the kind of big machinery that PSNP in Ethiopia or PSSN in Tanzania or the other programs have developed to deliver the cash to the people, at the same time, more or less, they have also developed the social workforce. They have provided resources and opportunities for the local government, social welfare officers or community development officers, at least to have the transport to go from their offices to the villages and meet the people, learn to know the vulnerable people by name, have the statistics, have the registration systems, have the connectivity to communicate with the central government, to have the monitoring and evaluation system, the payment mechanisms that can do wonders. If we looked at what those often women, competent professionals at the local government level, these social welfare officers do, they don't only deliver the cash, they also provide what we call psychosocial support or care. But this is, I think, important to remember when we talk about the cash transfer programs. They don't only transfer cash, they provide opportunities for, and when the people realize that the government is providing also multidimensional care through these local level professionals, that is the kind of the social contract thing that shows to people that the government is somehow interested in us, and that leads to the kind of societies that can be governed.
Yeah. I mean, often we are seeing, aren't we, that cash alone isn't really going to do much. Cash is important, obviously, but having those extra interventions that complement or augment the cash, such as it could be nutrition support, it could be veterinary education for agricultural people, it could be all sort of training to get people into jobs, that cash plus productive inclusion, whatever you might call it, graduation type program, they're really important, and the context will matter. There's no point giving a pastoralist what you give to a sedentary agriculturalist. If you're focusing on women and children, you might want to give them a different package. So it's very context specific. I'm going to keep the spoken comments to the panelists. I'm sorry about that. That's what I've been asked to do. So those who aren't on the panel with hands up, could you just put your comments in the chat box? So Sabella, would you like to say something? Or Gift, did you have your hand up first, Gift?
Oh, yes, only I had put it down, so I thought that I'll come in. I'll be quick. I think I'll pick on something that Ralph said, that I want to make it indirectly on inclusion, to say at times I view inclusion over and above to be included in a program, in a social protection program. A good example is, the harmonized cash social transfer in Zimbabwe, which is being scaled down, unfortunately. Well, we did studies just before COVID in an area called Binga. I was so amazed how cash transfers make the poor also participate in other informal institutions within their localities. For instance, a cash transfer would afford the poor to contribute into a funeral society or to contribute in a savings scheme. So they then become part of these informal schemes that tend to exist in the society. So there's this indirect inclusion effect that comes along with social protection. Thank you.
Thank you, Gift. Sabelo.
Yes, thank you. I just wanted to make a contribution on one area which we see as could be a transformative action to productive inclusion from the African Union. We think at a national level, another way of promoting inclusive growth could be the development of cooperatives. Develop the cooperatives to a point where you can say they are productive in various sectors. Could be in agriculture, it could be any other area, so that they become also social entrepreneurs. So social cooperatives could also be used as a vehicle, for lifting people out of poverty with the support of government. That's what also so at a practical level that could be referred to as inclusive growth in line with our social policies. Thank you.
That's right. Thank you. Thanks. A couple of things that have been sort of jumping out to me is the different priority groups that we have when we think about inclusion. So somebody said there's always a trade-off. We don't, in terms of the fiscal budget, right? Ideally, we want everyone to be covered everywhere, but the reality is that's not happening. Well, it's not for now, for a while. So therefore, there's going to be trade-offs. And therefore, the question about who's the priority group is going to depend, isn't it? So the youth obviously have high productive potential. Certain other groups, like old age people, might not have much labor, might not have high productive potential. They're going to need social assistance forever. There's a trade-off there also about who do you invest in? Do you invest in those who are potentially very productive, and then there'll be these spillover effects, and you're going to increase your tax payments and all sorts of positive things? Or do you say, no, we'll focus on the most poor, the most vulnerable, the most people with the less able, but that might not give you that positive growth. So how do you think about that as a trade-off in terms of your priorities for inclusion? It's not an easy question, I know, but I wondered if somebody, Nicholas is laughing, would like to comment on that. Yeah.
Yes, I mean, this is a tough question to policymakers because obviously the fiscal space to do all of this is not available. But I mean, looking at the priorities, what we have seen in Africa is that government is devoting substantial support to the old age, the elderly. And for very strange reasons, because this is the smallest percentage of the voting population. And so it is not providing them with sufficient reason to expand social protection. You realize that the politicians will want to see investment in social protection and the votes that they get. But they are not seeing that because the investment had been a small group of only 4%. If they invest more in the youth, but that is the challenge because that is about 40%, 30 to 40% of the vulnerable population. And that is huge investment. And that's where the middle class does not support. So there's a hesitation on the part of policymakers to give money or to support where the population is big enough to support them with the voting. So what should the politicians do? And that is the reason why they are not expanding cash transfer or social protection, because they haven't seen that multiplier in terms of votes. I think government should invest in the youth. And this is where the productive sector is so important, the education, the technical, the vocational skills. I think this is where the priority will have to be if we really want to sustain the growth that had taken place. And so my priority would be first, the elderly. We can't, because otherwise they'll be dying soon. So that has to be, but that is not good enough to expand the program. So the youth will have to come second.
Okay, this is interesting, but these are the tough political choices that have to be made. And the third set of questions in this round is around the sustainability. Is there political will to assume responsibility from the African government for any social protection program that might have started off with large donor funding, the political and the financial sustainability? So I think Gift just mentioned Zimbabwe, the HSCT. I've looked at that in the past, and that was a cash transfer for the ultra poor, and ideally that was going to scale up and go national, and it didn't. It's scaled back. And that's been really hard to get political support for because of the context, obviously. So how do we think about the political will? What's going to help to get, because often the finance is there. It's about priorities, where you put your money. Is it in the, which sector? So it's really about political will. Do you think evidence is what's important, or what do we think are the main drivers of getting people bought into big commitments around social protection? Any views, maybe from the...
Well, let me say that in Ghana, fortunately we have a government that is very responsive and responding to some of these issues. Fortunately, we are doing both. We are targeting the youth as well as targeting the other vulnerable groups, including the aged. So with cash transfer, we are still maintaining the 65 plus, orphans, the mothers with poor pregnant women, and mothers with children below one. Those are the vulnerable categories that we target in addition to using the policymaker test. And so we are reaching them as much as we can. As I mentioned, we have 2.4 million extreme poor people, but we have reached 1.5. We are gradually expecting government to increase the fiscal space to enable us to reach. In fact, last year we started discussing and drafting cabinet memo for justification why we need to have horizontal and vertical expansion of social protection. And so we are pursuing that agenda. But at the same time, government is also reaching out to the youth in terms of free education. If you look at Ghana, now from kindergarten to senior high school for public schools, it's virtually free. And so if you are poor, wherever you are in Ghana, if any child is expected to go to school from the kindergarten when the child is 4 years to when the child is 16 or 17 years. And so this is a huge investment the government is making. And at the same time, also supporting, giving cash transfer, working with donors to also, especially the World Bank on public works, also giving health insurance for people, because if you are a beneficiary of LEAP, automatically you will enjoy also cash health insurance. You mentioned about complementary services. We all have agreed that one intervention cannot, lift them out of poverty. They need multiple interventions. So if you are a LEAP beneficiary, for instance, you can also be, automatically you can benefit from health insurance. You can also be a participant or beneficiary of public works, that is LIPW, intensive public works. You can also even have your children also accessing school. We have free food for school. We call it Ghana School Feeding Program, and where we give one hot meal at least to about 3.4 million children. And so Ghana has multiple, interventions that are targeting, extremely poor and vulnerable people. And so we, even though because of this, we haven't been able to cover all the extremely poor people. But as I said, gradually we are expanding and we hope to reach all of them, not neglecting the youth. So we are having a comprehensive system in Ghana where we are targeting, various categories of people to make sure that holistically we reach the vulnerable and then excluded with interventions. Thank you.
Thank you, Rita. Nicholas put an interesting comment in the chat. Let's make social protection a political issue and compel political parties to commit in their manifestos. That would be a good thing to do. But at the political level, there's a lot of work. Technically, these things are possible, but politically, a lot of it hangs on influencing, persuading, cajoling, getting champions for change within governments, so that it's stuck in a constitution, so it's put into legislation, so there's a framework for rights that people know about. That's a really important part of this. It's not just about how do we target and how do we set up an MIS system. It's about the political will. Ralph, and then Gift.
Which I think is a very valid point, Rachel. It's about political will, but it's often also it's a bit of an economic question at times. Creating the fiscal space. It's a will question, and I think Rita, in an earlier statement, also made a very good point. It's an investment, and if it's perceived as an investment, it's more likely to find the attention of the Minister of Finance, who at the end is very often the one who can decide on the view on fiscal space, whether there is one or not. I think there are some examples one can quote. I mean, local economy effects, so using social protection to essentially create some local demand which stabilizes economic development, is certainly an argument which also a Ministry of Finance can comprehend relate to. I think the example of health insurance, which Rita also gave, I mean, it is certainly easy to see that a sick population can't be very productive, and therefore access to health care has to be created. And health insurance is not equal to access to health care. This is granted. I think there are also tax-based models which might work in many contexts more effectively than the health insurance approach could work. It depends on the context, but I think that's also something we can see. And as it has been mentioned before, I mean, even the IMF has changed its view on social spending in the recent years, given the new guideline on social spending, ring fencing social spending, even in times of economic crisis and downturn, which very much speaks to the point that social spending is not a consequence which you start doing after a certain economic development, but it is a precondition for economic development. And I think if these arguments are also being very strongly made in a beyond our usual suspects, maybe, I think that also helps creating fiscal space, plus obviously anchoring it in respective legislation.
Thank you for that. We've got 3 hands, so we'll take them all in a row because we've only got about 8 minutes of discussion left. Ulrika, and then Gift, I think I've got that right, and Sabelo.
Yes, I'll be brief. I'll continue on what Ralph said. I think it's important to recognize that social protection is an investment and not just for consumption. When we have 1/3 of all children being stunted, that is a severe effect on their lives. And throughout their lives as adults, they will be less productive. And this will have severe negative effects for the individuals, but it will also be a cost for the nation and for the national economy, and it will result in lower growth. So I think it is important to see these effects. And it's also important to see that all countries can do things to increase their revenue and increase the fiscal space for social protection and social spending. But at the same time, low-income countries will need to have support from external financing to develop comprehensive social protection in the foreseeable future, I believe. So it needs to be a mutual approach.
Yes. Great, thank you. Those are important points. 2 hands have gone down. Maybe you've made the points. Gift, did you want to make the point?
Yes, just I think the issue of political will at times I have a feeling that it's there. Politicians like to impress, like all of us are saying when we are voting, we need this to be in the politics. But I think it's there. Even if you look at the Addis Ababa, what do you call it? Is it agenda 2015, where the African government signed to say we're going to domestically finance social protection. There is that part, I believe. But I think what we lack most is our accountability mechanisms to push our governments to commit to what they have said they will do. So in most cases, if you look at those who are even campaigning, they do mention these things that we will engage in this. Recently, using the HSST again, you'll discover that the government still wants to portray like the program is running. They still do want that, but on the ground, it may not. So we need people to take them accountable. And I think the civil society role needs to be huge within the social protection fraternity. Like if you look at South Africa, civil society is playing a huge role to make sure that grants continue. Even during the pandemic, they played that role and the government ended up doing it. So there is that aspect that I feel needs to be pushed. Not necessarily political will, but accountability.
That's right. It's very, very important. I've interviewed some recipients of the cash transfer in Zimbabwe, and I specifically asked them, I said, what would happen if tomorrow you didn't get any more of your handouts. They said, oh, it doesn't matter. I'd just be pleased to have had some. So they saw it as a handout, as a gift, as a discretionary. They didn't see it as, even though it was told, oh, it is a right, you'll always have this. They're like, no, I'm just happy I'll get anything. So that is just not going to be a way of holding anyone accountable. So it's really a lot of that civil society. If you look at the way that cash transfers came up in Brazil, or even in India on the NREGA, there's a lot of civil society movement around that. So I think that's right. Nicholas, or Sabelo did have your hand up. I don't know if you want to say anything. If you can make it brief, that would be great. Thank you.
Yeah, I think I've made that point. Getting the coalition to support, and that means getting the middle class in Africa to support social protection. I mean, I have had a chance to talk to many senior policymakers and the growing middle class in many countries. And there's resistance from the middle class to pay more taxes. And social protection cannot be expanded through international solidarity. It needs homegrown revenue or financial mobilization. And if we don't have the middle class to support such a coalition, then there's little government can do. The issue is that the politician is looking at the votes, and currently there appears to be, data is not supporting that governments that are introducing more support are winning elections, or if they are winning, the investment and the return is not that very strong in terms of what they are getting back. And so, unless there's that strong coalition from the middle class to push for more political support and to commit government to support providing more money, that cannot be expanded. Because research has shown that we need about 1.7% of a GDP to support universal social protection in many countries. And I mean, the ILO made some of these figures. Then in many countries, we have done the study. You need about 5% of the national budget to dedicate for social protection. But at the moment, it is not. In so many countries, it's less than even 0.1%. And so the political will is there, but government hesitation is based on the uncertainty of the economic growth, the uncertainty about the international commitment to the long-term funding of it. Because, you know, they are a bit of unsure. If they commit so much and then donor fatigue set in, then there will be extremely high pressure on them to continue, because social protection is such that once it is it's introduced, it cannot be withdrawn.
Okay.
Especially in a democratic setup, it cannot be withdrawn. So this is where the dilemma is with government.
Thank you, Nicholas. I fear that we have come to the end of our session. Well, not quite the end, unless there's any very quick comments from panelists. I'm going to hand over to Jolien from the Ministry in the Netherlands to give us a little bit of a reflection in terms of her takeaways from this. But did anyone want to say anything very quickly first from the panel? Okay, well, thank you.
Yes, I did.
Yes.
Yes, just one thing. Sabelo, in terms of expanding the fiscal space for social protection, just want to remind us the role of the private sector. Back then, we used to have a private sector coming with social responsibility initiatives where they contribute to the communities. And I think social protection can benefit a lot. I don't see a lot of that now these days. But back then, we used to have popular social protection initiatives by the private sector. But I also think the role of the CSOs is also important. We have seen them developing the IGAs, the income generating activities for sustainability. We need that. But the last point that I wanted to throw is a very controversial one. The rich others are calling it, it was a suggestion from one of the eminent persons who was actually was awarded an international present. The rich tax or opulence and affluent tax to be able to finance some of the projects and programs for the poor. This suggestion has been put out there. I don't know how practical it is, but I'm leaving it to the wisdom of the panelists and to be able to
Great.
take this one.
Thank you. Thank you. We're not going to open up a controversial topic 2 minutes before the end, but that isn't a discussion for another day. So thank you everyone for participating. Sorry we couldn't go through all the comments, but Jolien, I will pass to you now. Thank you.
Yes, thank you very much. And this has been a really rich hour for me, and I have been typing actively, and I heard so many interesting and important aspects, which absolutely I will take back and have further discussions in the ministry. I was absolutely hooked on the youth unemployment and youth employment situation. And I think with Include, the ministry also works on youth employment and integrating social protection aspects in this youth employment really would fascinate me. And I would like to have a further discussion on that. About the remark of gifts, of the indirect impact of social protection, of the cash transfers that have people with the support of cash transfer are also hooking onto informal saving schemes and other social events happening in the community, being able to go to church because you're aware you are able to buy a new dress, and being part of this church community, for example. I think that are also very important aspects of social protection, which really leads to inclusion, not only economic inclusion, but really social inclusion. And I think that is what makes life matter. And donors and policymakers and researchers and NGOs also very well taken note the importance of the role of NGOs. I think we are all, we have a huge task ahead, and we should not let it slip in between our fingers at the expense of a lot of people who absolutely need this support and deserve this support as a human right. So thank you very much, and definitely looking forward to further the discussion with all of you, and wishing you a nice afternoon. Thank you very much.
Thank you. I'll take over then as chair of the whole session. I must say what I find the interesting from the point of view of the Include Knowledge platform, where we have 3 substantive pillars that we've been working on for the last 10, 12 years now almost, namely youth employment, strategic actors in development, as we've called it, and social protection. And what I've seen happen this afternoon is that we started with social protection, say that how and the what, and what particularly are the spillover effects. But they have linked very closely, particularly in our discussion of the targeting of which social groups in society, to issues that we've been talking about in Include, in terms of youth employment and which groups among youth are the most vulnerable and how they can be supported in building up their lives. And we've linked that very specifically to the agricultural sector and the transformation from agriculture as a way of life to seeing agriculture more as a way of business. The second part, where we've talked about strategic actors in development, has come back in this discussion as well in various ways. One, say the households, if you like, as strategic actors, where the cash transfers have actually allowed people to participate in society, as Ulrika was saying, as a human right. And these, in principle, very small contributions make such a huge difference in the extent of inclusion that people can have. But it also, when Nicholas talked about, say, maybe the hesitation of politicians, even if they're willing to develop, as it were, a new social contract through much more extended social protection, that there would be a backlash among the middle class who does not want to pay more taxes. So there, that lack of social solidarity, you could say, among different social groups in society, and not only limited to Africa, because you can see this also, say, within Europe and in other countries in the world happening. But that lack of social contract and the difficulties and the barriers that creates to actually promote a more inclusive society. So these linkages, to me, were actually one of the strong points, one of the strong outcomes of this discussion, which I was very happy to see, and actually further justifies the kind of work that we've been doing as platform members over the past years and hope to do for the coming years. I'll leave it at that for this session and hope to see you all tomorrow when we go into the fifth session and the closing session of this conference. Thank you very much, all of you, for your contributions and for your very spirited discussions. And see you again tomorrow. Thank you.
Thank you very much. Bye-bye, everybody.
Thank you. Bye-bye.
Thank you. Bye.
Thank you very much.